Thank you, everyone, for joining us today. Our paper will be talking about community perspectives on addressing and responding to HIV/AIDS among African, Caribbean, and Black people in Ontario. This is building on a project we recently completed on HIV surveillance within the ACB community in Ontario. Our paper today will be presenting primarily the qualitative component, data that we got from a World Cafe evented focus group that we held last summer. So the overall purpose of our project was to estimate HIV prevalence and facilitate improved understanding of associated behaviors, knowledge, individual, community, and structural factors, as well as healthcare access and utilization among Ontario residents of sub-Saharan African Caribbean backgrounds. The specific objective of the qualitative component, which is the focus of this particular presentation, was to provide ACB community members with an opportunity to participate in the interpretation of the quantitative surveys, to generate more data, and also to be involved in the formulation of recommendations for this project, which was funded by the OHGN uh, Ontario HIV Treatment Network and also supported by the Public Health Agency of Canada. Theoretical framework that informed this part of the work were the socio-ecological model, intersectionality, community-based participatory research approach. We used the World Cafe event as our qualitative research design to organize 12 focus groups involving 107 members of the ACB communities from the cities of Toronto and Ottawa. Our data analysis used was guided by thematic analysis for the interpretation of the key themes. And in terms of trustworthiness, this was established through validation strategies such as external audit with members of the community and the research team that reviewed the research analysis and provided input throughout. Our findings came up with 5 thematic areas: community perceptions of research importance and challenges, factors associated with HIV vulnerability, experience with HIV testing, and the use of PEP and PrEP, community perspectives on how to address HIV in ACB community was the 5th theme of our findings. I would try as much as possible to share some of the quotations with you, but given limited time for this presentation, I would limit the number of quotations that I can actually read out. So number 1 is the community perspectives in terms of the research challenges. You can see here focus group participants overwhelmingly confirmed the importance of this community-led research project, but also identify some challenges. For example, one of the quotations here says, and this is from a mail in the Ottawa, one of the Ottawa focus group. It says, I think when you have researchers from the community that are taking the lead role, that diminishes the barriers that and motivates people to take part because they see themselves in the researcher, in the lead person, and that comes with trust, right? And then you feel like you know that there are actually benefits for the community from that. So I think having people in lead roles in research that reflect you would motivate you to take part as one example. So that's just one example of the importance of having people from the community lead research. The second theme here is factors associated with HIV vulnerability. The individual, interpersonal, community, institutional, and structural factors were found to increase HIV vulnerability in ACB communities. So, for example, this first quotation says, I just feel like there isn't enough education in this country compared to mine, some on where I am coming from. Where I'm coming from, there's so much more education, so much sensitivity, so much information. I don't know if they are doing enough here. I don't see it. I don't really see it. I don't really see it. This is a female from Toronto site. And you can, then the next quotation talks about stigma. Again, that is from one of our Toronto focus groups, So people are pointing to the need for more mainstream education about HIV and the stigma associated with it. The next one is the experiences with the HIV testing. So the fear and stigma among um, the community is most frequently cited as reason why community members didn't have access to HIV testing. The process of assessing testing is degrading and insensitive, somebody said. The lack of access to post-testing counseling, self-testing kits may reduce stigma, one person recommended. I cannot read more quotes because we're running out of time. So the next point was the use of PEP and PrEP. Few participants were aware or have direct experience with the use of PrEP and PEP. In terms of prevention, and actually this treatment may not be known to many of the women, of the people that participated in this. So example of a quote say, so even when you go to PrEP, where there is, which is the pre-exposure prophylaxis, is supposed to be like, as gay men say, gay white people say, it's supposed to be like birth control. You take it, you don't get pregnant. But here, there is PrEP, but who can access it? Who is PrEP for? How many Black people access PrEP? So people were just pointing to this lack of awareness of the importance and the value of PrEP to them. And so it speaks to more education. Our fifth point here is the community perspective, and we have so many ideas here for the individual level, the provider level, and also the integrated strategies that people pointed out, including partnership between ACB and non-ACB healthcare providers, but also the use of positive role models at the individual level, as well as increased access to HIV testing and training for providers. In terms of implications, people talk about community level implications, service level implications, and funding. They also pointed to policy level implications, such as addressing the structural and institutional factors that contribute to HIV vulnerability, including poverty, racism, and other barriers to access to information. So critical racial literacy is an important part of recognizing some of the needs that perpetuate both systemic discrimination and also stigma. They also talk about the need for the collection of race-based data to identify and address the inequities that exist that impact on how people see this. So in conclusion, ACB communities are actively engaged and motivated to work towards system change to improve ACB living conditions. Communities, service providers, researchers, funders, and policymakers must work together to improve the lives and health and as well as HIV outcomes for ACB community members. Thank you. And I would like to acknowledge all of the partners that have contributed to this project, including OHGN and Public Health Agency of Canada, the Health Association of the Canadians of African Descent, that have all partnered to make this project a success. Thank you. We'll take questions now.